autonomous vehicles coming on board, and that's, we have our eyes on that. That's another challenge, Secretary. Thank you, Mr. President.
Thank you. I apologize for an apology for staying later. This is our management structure. We have an executive leadership team that Secretary Moran and I co-chair. You can see with this group being here, what I hope the point is that we are working together and trying to align as best we can. Our friends at the court, for reasons, can't be here today. Drug courts are a part of this. Therapeutic dockets are very, very useful, and we've not mentioned those. There are some other things that we could get into. The key is we are trying to use the best research that we have to treat addiction, prevent addiction, and to create a better public policy, and this is a unified approach. And I thank you for joining us on this.
Are there any questions? Dr. Van.
I have one for Dr. Levine. Why is hepatitis C far southwest and HIV in eastern south side?
So hepatitis C in far southwest is related to the fact that even though we've had a prescription drug issue there, people are injecting substances. So we're seeing that hepatitis C is spreading in that locale. It will spread to the rest of the state. I think there's no question about that. There are more cases. The map I showed you for HIV were new cases. So we have HIV everywhere, but the new cases are predominantly occurring in that part of the south side. And the issue we have is when they join, if we have the drug issues that we see in the south, far southwest, in the middle of the south side, then we're potentially going to see the HIV outbreaks that we've seen elsewhere.
So if I saw that slide right, somewhere between 0.5% and 1% of every citizen in southwest Virginia is hep C positive.
Well, that may be an underestimate.
That is a very scary
That's the tsunami I'm talking about.
Yes, sir.
Mr. Chairman, just briefly a comment. First of all, I want to thank you, sir, for your leadership in bringing this to us. We've got to all get up to speed on this. This is a global issue. Every time you see on the front page of your sports page in your local papers that your local star quarterback or wide receiver just blew out his knee, that is a child that is at risk for what we've been talking about all together. So, Secretary Hazel and Secretary Moran, I very much appreciate your leadership as well with this. I also want to draw everybody's attention to two things. First of all, take the time to Google opiate versus opioid, because we're going to need to make sure that we are speaking the same language in this. As you all know, opiates come from plants. Opioids are synthetically manufactured. And they're in the same family, but we need to be talking about apples to apples. Secondly, we all have at our desk in ending the opioid epidemic. It's well structured. There's this very busy color pipeline thing, but I think it's actually very instructive of where we can intercede along this path. And finally, over the last 2 years, we've done a fair amount, and this was your effort, Mr. Chairman, to try to bring to the table the things that we're already doing statewide. We're going to have lots of individual things and bullets to shoot at one particular piece of this pipeline, and we're going to need to be very thoughtful. So Chairman Jones and your earlier, Chairman Anger and Chairman Norman, we're going to have to figure out how we're going to be able to afford all this going forward. Thank you very much, Mr. Chairman.
Any other questions? And I had just one observational statement. One of the main takeaways that I get, besides just the whole complexity of the issue, that what has changed is the path to addiction. It's now through prescription drugs. And if we think that in the short term we're going to alleviate the illegal drug problem, as a matter of fact, it's probably going to have a short-term negative impact in that regard. That as we change the addiction path, being through prescriptive drugs, those patients who are already addicted are probably going to be turning to illegal sources in order for that initial treatment. So if we think, as was suggested, there's some silver bullet, but we know if we can remove or mitigate the current pathway through the prescriptive end, then we're going to ultimately be mitigating and reducing the underlying addiction problem through whatever means. Law enforcement has been yeoman's efforts throughout the years trying to address the illegal drug problem by removing access, things of that nature as best they can. But so that's gonna be critical in our thought process. We're not fixing it. It's gonna be a measured approach. It's gonna take a number of years to try and resolve, but we've got to start, you know, at this stage. I think Senator had a question or comment.
Well, just a comment and to show you the complexity of how you're dealing in Virginia with this epidemic is Southwest Virginia, unlike the spread of the addictions or getting to the hepatitis C issue that Delegate O'Banner brought up. In Southwest Virginia, we're a lot closer to other states' capitals than we are to Virginia's capital. So we are surrounded by 4 states and it spreads into our region from those states. And that is one of the needs that we have working with HIDA and other groups to address the issue. And whatever we do in Virginia, we have to be mindful of how other states are trying to control the epidemic too.
This stuff clearly does not respect geopolitical boundaries. And we had, in the end of 2015, a summit in Wise where we brought our neighbors from North Carolina, Tennessee, Kentucky, West Virginia, and Maryland to the table. We've had subsequent work with Maryland and the district. There's data sharing. Law enforcement, I think, Senator, your world has historically done a bit better job than my world has in terms of dealing with this, but the issues of, in your part of the world, the neonatal absence babies are often treated in Tennessee. That's where the moms are. I was in Bland a few months ago, and they said a woman tried to go to West Virginia to have her baby to avoid social service, but that doesn't actually work because it gets reported when West Virginia and Secretary Bowling there closes down a Pell Mill, they relocate to Withville. So these are things that we are seeing. There is no silver bullet. It's going to take harm reduction until we get the treatment in place. We have to have treatment or these people are lost to us. And who pays? We all do. We have to do the interdiction, the prevention piece, and we have to do the culture thing. We have to do it simultaneously. It's not, there's no real good alternative to this. And I hope what you've seen here is the level of collaboration is unprecedented, and we are modeling this in our mental health approach as well. And our mental addiction is part of mental health and physical health, and it goes together. But the fact that Major Settle and the state police and sheriffs are an important part of it, they are. And we fully support their education, their training, their staffing, and their funding.
Any other questions or comments? Dr. Hazen, we thank you very much.
Sorry to be so long.
The comprehensiveness of the report y'all brought forward this morning, I think something we're going to have to keep in mind as we continue through this session, work with y'all to try and do all we can to assist you. There's nothing else from the committee. Thank you again for coming. The committee will